Yeah, the CAR-T scenario, obviously, with the approval of the first CAR-T in myeloma, ide-cel has really, uh, ramping up, really been ramping up over the past few years with multiple different CAR-T cells being studied in the clinic right now. The ide-cel, we saw some updated data at these recent meetings, again, consistent with what we have seen in the past, no new toxicities. The responses in some of these patients appear to be quite durable. And interestingly enough, the overall survival of some of those patients on the original CAR-T trials, even though the progression-free survival was not as long as we had hoped it would be, was still quite good. So with almost a 3-year overall survival, that certainly seems to change how the subsequent therapies impact these patients. Interestingly, we now have some additional data from Cilta-cel, which Dr. Swan, you presented at the recent meetings, clearly showing more, with more follow-up. There is clearly durable responses with again progression-free survival almost getting to close to 2 years. Now, it's difficult to compare these different CAR-Ts because these are all two single-arm trials with very significant differences in the patient population, even though they all had a median of about 6 lines of therapy. But I think the responses over 90% of response rate, high rates of minimal residual disease negativity, and durable responses, I think will make CAR-T an integral part of myeloma therapy, particularly in the earlier lines of therapy as more data becomes available. What I think is going to be the more difficult part to discern with this data is the toxicity and if there's some differences in toxicity profile across the different CAR-T products. And particularly, I think Sadi presented on the neurotoxicity with Cilta-cel, which again, the whole gamut of neurotoxicity remains a mystery because we don't really fully understand why that happens in these patients.